Today's show is sponsored by the Dog Cancer Survival Guide, the best-selling book that helps you help your dog with cancer. Join the companion private support group at dogcancersupport.com and get the email newsletter at dogcancernews.com.
The chemotherapy is certainly a big concern because those are, don't have just minor side effects or whatever. If a drug goes out and an animal is able to ingest it from the environment, that's certainly a big concern with the chemotherapies. But all the other drugs are not very particularly useful either. I mean, there's antidepressants being found in water sources and things like that. I just definitely don't need to have all that secondary exposure.
Welcome to Dog Cancer Answers, where we help you help your dog with cancer. Here's your host, James Jacobson.
Hello, friend. Now, I don't know about you, but I have a couple of little bottles of dog medication that I no longer need, but just don't know what to do with. And to clear up that mystery, we are joined by our medical editor and practicing veterinarian, Dr. Nancy Reese. Dr. Nancy also has a master's degree and a Ph.D. So when it comes to pets and medications, she knows her stuff. Dr. Nancy, thanks so much for being with us again today.
Thank you so much for having me.
Today, we're going to talk about leftovers, and I don't mean what's left over in the fridge after a big meal. I'm talking about leftover medications after perhaps your dog dies or the course of treatment, you got more than you needed and the disease is gone. What should people do with those leftover medications that cost a lot of money?
Well, I certainly like the second scenario better, that the dog no longer needs the medication, so you have some left over. That's always a better situation.
Those blue bottles, that means veterinarian, basically. Is that the difference so someone can determine those plastic pill dispensing bottles? Is that the color that vets use?
Actually, their bottles will come in all different colors, and there's no specific. So we have pink, green, red, gold. I think those are the big ones. Okay. But yeah, I think it depends on what company you order from.
Okay. I thought there'd be, there's a secret decoding ring. There isn't. Okay, but what do you do with the leftovers, regardless of why you no longer need them? What's the best course to do?
So that's actually, I'm glad you asked that question in a way, because to me, it starts to become even an environmental issue. In the past, they used to say, open your bottle, pour it down the toilet and flush it. Mm-hmm. And we all thought, great, that's, bye-bye pills, everything's good. And then now they can find, traces of so many drugs in the water system and in the soil and things like that it's just able to leach out. So certainly flushing is not the way to go.
It seems like such a primitive, one day people did what? It's like the old commercials where doctors were doing commercials for cigarettes. So the idea of just open it up and throw it down your toilet just seems so barbaric. But that had been the advice for a long time.
Right. And so certainly that is no longer recommended, although I still hear people doing that anyhow, because there's not like a public information campaign to get out there saying, don't flush your drugs down the toilet, but maybe we should make one of those.
And people, especially with oral chemotherapy products, that can be pretty bad.
Right. The chemotherapy is certainly a big concern because those are, don't have just minor side effects or whatever. If a drug goes out and an animal is able to ingest it from the environment, that's certainly a big concern with the chemotherapies. But all the other drugs are not very particularly useful either. There's antidepressants being found in water sources and things like that. I just definitely don't need to have all that secondary exposure.
Okay, so what do you do?
Probably the safest, best thing to do. Most counties, at least, and even I'm in a pretty rural county, so if we have it, I assume that everybody has it. There are a couple times a year they will put some drug takeback programs. So there are places that you can go. Ours is often at one of the county administrative centers or outside the police department things. They will have bins outside, and you can take your medication, human or animal or anything, and drop it off there. And it's monitored by law enforcement, at least around here. And that's they don't check your name, they don't check the drugs, they don't do any screening. I think it's just there so somebody doesn't come along and try to steal the drugs.
Yeah. Ooh, what have we got in here? Yeah.
Yeah, right. So I love those programs because I will just save my expired or not used medications. I'll put them in a big thing in a child-proof container and away from anybody with big X's all over it so that everybody can see this is not to be taken, and then take it to one of those drug take-back programs. So that's the safest way because they're going to be disposed of in a manner that hopefully doesn't start to get into our environment. However, again, and I always refer to my rural county, because of the cost of medications and the likelihood that people have more than one animal, if somebody calls and say, what do I do with this medication? Depending on what it is, I will recommend that you hold on to it. Again, keep it in a child-proof container away from somewhere else. But if it's something like an anti-inflammatory, where if your next dog gets hurt, you might want to have something on hand. The biggest caveat to that is you need to call if you're thinking of using that medication because it may not be appropriate for that next animal because of its condition or another medication that's on, or even the breed or species of the animal. Those things are huge. But I will admit that we have people keep medications so that if they have an emergency and we can't see them and we know they have something that might tide them over until they can get in, we will give them an appropriate dose of that medication by phone.
You just happen to have this on. And what about the expiration date? Because sometimes, there's a pretty tight expiration date, at least with many of the veterinary drugs that I've seen that are, redispensed by veterinarians, but they have a tighter expiration date. Would you even think of using a drug past its expiration date?
Legally, the expiration date, it means, okay, get rid of it. You can't use it anymore. Mm-hmm. Practically, I have used plenty of expired medications on myself and maybe even in my own pets, depending, again, on the type of expiration date and also the condition that I'm thinking of treating. So there's some companies might put an automatic expiration date of 3 months from dispensing, and it really doesn't reflect the actual longevity of the medication. So there's, like some veterinary programs could potentially just spit out a expiration date of 1 year from the date that it was prescribed.
And when you say programs, you mean like the software that's used in the clinics that they use to label that. So even though, because a vet, you get a large unit of hundreds of pills and then you count out 30.
Yes.
And then the program, the software that is used to label that may just say, oh, it expires in X number of days, when in fact, that's not really what's on the bigger container.
Exactly. So it depends on the type of medication and even the form that it's in. Like a liquid medication likely may expire before a capsule or a pill, but it's like some places have a policy that we're going to put a 1 month expiration regardless of when the pill actually, quote, goes bad. But yes, and if I was treating something minor, if, we're thinking it's a little injury that might need a non-steroid anti-inflammatory, and we're not trying to talk about bone cancer or something that's extremely painful, I might have somebody actually give an expired form that they have at home. Again, if we know the right dose, the other medications the animal's on, and we can't get them a fresh supply anyhow. So it really depends on the condition that might be treated and other competing things with the animal. But yes, I in all honesty, I've used expired drugs. I won't prescribe an expired drug to a patient, but in my own household, I've certainly used them.
Is there, when one talks about drugs in general, they think of safety and efficacy. So expiration dates, does that mainly apply to the efficacy? In other words, it's not potentially not as effective, but does it increase the safety risks?
The majority of it is efficacy. Okay. So that the drug might not be as potent, but rarely it's going to be a safety issue.
Oh, it expired and it's going to kill you now.
Exactly. Yeah.
Okay. In terms of like donating it to a vet clinic or a shelter, what are your thoughts?
So that's again a touchy subject because there's probably what is on the books as what is required to do versus what is humane and things. So a shelter having some of these things on hand, or for low-income things, again, especially with non-expired drugs. But the biggest problem is that technically when something leaves a veterinary office, even in some cases if it isn't opened, we can't take it back because of the risk of some kind of tampering with the medication. So that's really tough to have people say, you know what, I don't want this anymore, or I use one pill and I don't want it anymore. It makes it a really tough challenge because we have to tell them we legally can't take that back. But there, you may check with some of the organizations in your area as to what their policies are on that. We certainly had to get more strict with that. In, quote, the old days, we used to take all sorts of medications back because we could reuse them for, again, a charity case or, some of the shelter cases and things like that.
We're going to take a short break here, but we will be right back. I want to let you know about an important newsletter. It's called Dog Cancer News. Now, with a name like that, it is not for everyone. But if your dog has cancer, you will want to subscribe. That's because every issue features articles that will be helpful, such as low-carb dog cancer diet recipes, new clinical trials, financial resources to help pay for cancer care, information on supplements, and lots of other helpful info that your veterinarian may not know or have the time to share with you. Also, when you subscribe to Dog Cancer News, you will get a weekly update on the topics covered on this podcast, along with links and resources. So how much does Dog Cancer News cost? Well, today, you can subscribe for free. It's our gift. For a limited time, you can get a full year's subscription for free, no strings attached. Just go to this website to sign up for the newsletter now, dogcancernews.com. It takes less than 10 seconds to subscribe, and it is totally free. Do it now at dogcancernews.com. We are back with Dr. Nancy Reese discussing what to do with leftover medications. Before the break, you mentioned a little bit about drug take-back programs and that they're guarded by the police in your area. So how do you find out about those?
That's always an issue because in my area, I'll see either little flyers posted somewhere or on some things like social media sites like Nextdoor. I don't know if people have that, but there's different neighborhood area things where they might post something like that. But it would be nicer if they had a more widespread announcement of that.
There's no national clearinghouse. There's an opportunity for someone to build a website, National Clearinghouse, where you can just type in your zip code or wherever you live and find out. So if you can't get to or know about one of those take-back programs, and you do have some oral chemotherapy products, and you no longer need them because you no longer need them, can you put them in the mail? What do you do? Because these seem like particularly difficult things to get rid of.
Depending on where you got it from, most veterinarians should be able to take that back because we do have companies that will take our drugs and incinerate them or whatever it is they do with them. But we do have special containers that we will put particularly chemotherapy things in. So you put the whole vial, and if it's an injectable product, we'll put the whole syringe and all the tubing and all the gloves and everything in one of those special containers that then allow for proper disposal. So you can get rid of those. Again, that's definitely not the type of drugs we want out in the environment.
So most vets obviously have a way to dispense with biological waste. And
yes.
And these drugs would be considered part of that. So you could hopefully, you bought it from the vet, they should be able to take it back. At least dispose of it.
Yeah.
Dr. Nancy, this has been very helpful. Thank you for being with us today.
Well, I hope it provided some information for people and hope they never need any of this advice.
And thank you, listener, for hitting that play button today. So the moral of the story with leftover medication is don't flush them down the toilet, but instead look for drug take-back programs in your area so that you can safely dispose of those meds. You may also be able to dispose of some drugs like oral chemotherapy pills at your veterinarian's office. And if you've hung on to some extra meds, always call your veterinarian before giving them to another pet, just to be sure that they are safe to use and that you're giving the correct dosage. To learn more about various cancer medications, visit our website at dogcancer.com. You can also subscribe to our newsletter at dogcancernews.com. Dog Cancer News comes out 3 times a week. It's a great newsletter and has all kinds of information related to dog cancer. And it's free. Just sign up at dogcancernews.com. That is all for today. I'm James Jacobson, and from all of us here at Dog Podcast Network, I'd like to wish you and your dog a very warm aloha.
Thank you for listening to Dog Cancer Answers. If you'd like to connect, please visit our website at dogcanceranswers.com or call our listener line at 808-868-3200. And here's a friendly reminder that you probably already know. This podcast is provided for informational and educational purposes only. It's not meant to take the place of the advice you receive from your dog's veterinarian. Only veterinarians who examine your dog can give you veterinary advice or diagnose your dog's medical condition. Your reliance on the information you hear on this podcast is solely at your own risk. If your dog has a specific health problem, contact your veterinarian. Also, please keep in mind that veterinary information can change rapidly. Therefore, some information may be out of date. Dog Cancer Answers is a presentation of Maui Media in association with Dog Podcast Network.